Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. This is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. And today I'm joined with Dr. Shawn Johnson. She's a board certified orthopedic surgeon and sports medicine specialist here in the Houston area. So we're so excited to have you here, Dr. Johnson.
Hello, thanks for having me. I appreciate the opportunity to educate people about bones and joints anytime I can.
Yeah, thank you. Thank you for being here. So, today we're going to be talking about how metabolic health, which is things like weight, blood sugar, cholesterol, inflammation, how they can affect joints, and what you can do to move with less pain, protect your knees, your hips, your shoulders, and more. So, for those that don't know me, I'm Dr. Lola Ashaye. I'm a family medicine and lifestyle medicine physician and owner of InTouch Primary Care here in Sugar Land. And what we do is we help you become and stay healthy so that you are able to achieve your dreams. And we do this by providing hassle-free healthcare. You can learn more about us at intouchprimarycare.com. So, Dr. Johnson, okay. So we see a lot of patients with pain in primary care, and joint pain is huge, right?
Yeah.
So when it comes to joint health, what's the first thing you want people to understand about how conditions like extra weight and high blood sugar and cholesterol can affect the way the joint feels and functions?
So I think the biggest takeaway is going to be that inflammation rules the nation. Like inflammation is the biggest thing. And when you talk about metabolic disease, the primary issue is that those conditions increase the amount of inflammation that you have in your entire body.
Mm-hmm.
So when you put on extra weight, your blood sugar is not controlled, your cholesterol is high. We all are dealing with these types of things as we get older, obviously, we all are. Um, and you wonder, why are my joints hurting? The first thing I would like people to think about is that inflammation is what's causing the discomfort. Of course, there's other things that cause inflammation, but if you know you haven't had an injury or anything of that nature, and you do know that you have a history of these metabolic conditions, inflammation be the first thing that jumps in your head.
Okay. Yeah, thank you for sharing that. And I think that's a really nice way to put it, that these other conditions increase your inflammation. And so, if you already have a trigger for inflammation and then you add these other things on top of it, it
Right,
just makes it a lot worse. Okay.
right.
So we often hear people, say that you just, shedding even a little bit of weight can ease joint pain, especially in the knees and hips. Can you help us understand how even small changes can make such a big difference?
Well, I think people need to realize, well, first of all, your weight bearing joints. So your low back, your hips, your knees, your ankles, your feet, those are the things that are carrying around our weight. So that's why those things are going to be most affected. That does not mean you can't have upper extremity discomfort, but that's why the lower extremities are the ones that are most affected. Um, just having a small amount of weight change um, can have exponential benefits because every pound is seen as like 4 pounds to your lower extremities. That's the best way for me to explain it. An additional 4 pounds of pressure.
Mm,
Okay. So in particular, the one thing that I try to get people to understand is that the patellofemoral joint, so your knees in the front, where your kneecap and your femur meet, um, there is so much stress that goes through that small area in your body.
mm,
God knew it. The thickest cartilage in your body is underneath your kneecap.
mm,
Cartilage is meant to disperse pressure and stress. So when people have knee pain and they have these underlying conditions or they're overweight, I try to get them to understand when you rise from a seated position, go up and down stairs, all those types of things. The first things that people come in and say, that hurts, that hurts, that hurts, that hurts. You're putting so much stress through your patellofemoral joint when you do those things that's why you start to notice that hurts. So just a small amount. So every pound you can think about decreasing 4 pounds of pressure, which is
Mm-hmm.
why we say just a little bit of weight, 5 to 10% of your body weight can make a huge difference in your lower extremity discomfort. Now, with that being said, I also try to explain to people that once the damage is done to your cartilage,
Mm-hmm.
you can't reverse that. Structurally, you cannot reverse that. However, you can decrease the stress that now pathologic cartilage is seeing by decreasing your weight, et cetera, et cetera. I have a great story about, I'm not going to say a story, well, she's a patient of mine. I've been seeing her since 2021, I think. Yes, and I've been in a couple of different practices since then. She just followed me every time when I move. She found me. And the last time I saw her at a previous practice, she was very heavy. And then she found me at my next practice, and she walked in, and I was like, because she had lost so much weight. And she said that, and we were like this close to
Mm-hmm.
replacing her knees at one point. And now she's like, I just feel so much better.
Mm-hmm.
If you look at her x-rays, they still look horrible.
Right.
They look horrible. But she feels so much better because she's lost weight and she's kept it off. And now we're maintaining her discomfort just with, conservative methods and less invasive things, injections, things like that. But that was one of, if I could put her on a poster and be like, hey, it works,
There you
she
go.
would be the person that I would put on the poster
Oh,
because
wow.
it actually makes a huge difference.
Thank you so much for sharing that because this is we have a healthy weight program. It's called Reset Thrive 365. And this is the experience that we've had with people in that program where they just lower their weight in the first few months and they notice significant changes in terms of the pain in their joints.
Yeah.
And even a little bit, like you said, and I love the way you express that, saying it's like your knee thinks it's saying 4 more pounds than it really
Right.
is.
You're looking at the scale, it says whatever.
Right.
And he is like,
No. So by just even the little changes make such a big difference. Five, like 10% of your body weight can give you significant health benefits, not just even for the knee, honestly, for diabetes, high cholesterol, which reduces all that inflammation we're talking about. So it really makes a big difference to invest in doing that. And I would recommend people should try to do that sooner than later.
yes.
Because, like you
Save
said,
your cartilage early. Save your cartilage early.
right. If you do it early, you lower your weight early, you've saved your cartilage early. We don't have to deal with the pathological cartilage, which can't handle as much stress as a normal one. So, um,
Exactly.
yeah. Okay. So inflammation, right? We hear that word all the time. So can you explain a little bit more how these chronic inflammation show up in the joints, whether it is with stiffness or pain or arthritis? Like, can you just give people a little bit more information about that?
Okay, so first of all, I want to make sure that everybody knows inflammation is not a horrible thing, right? We need inflammation. That's our first stage of healing. We need it. So don't get me wrong. However, chronic stages or periods of inflammation cause weakening of tissues, um, which can lead to weakening of cartilage, wear and tear of cartilage, weakening of tendons, weakening of muscles, things like that, which can predispose them to injury, right?
Mm.
So um, when it's really cyclical. like you were just saying, if you lose the weight now, you can also decrease the stress, but you also decrease the inflammation, which helps you protect your tissues more, et cetera, et cetera, et cetera. So that manifests as swelling, pain. You may not even have swelling. I tell people your knee doesn't have to get as big as your head for it to be swollen, right? It can be. I ask people differently. Does your knee feel tight at the end of the day? And they go, yeah, yeah, yeah. I said, well, it's probably swelling. If
Mm-hmm.
in the morning it's not tight, in the evening it's tight, then it's probably swelling. So swelling begets pain. Pain does not necessarily beget swelling. The reason swelling begets pain is because it stresses the capsule of the joint. That's uncomfortable, right? Um, stiffness. Stiffness does beget pain. So one thing I also explain to patients, and I try to educate them as best as possible. It's not their fault that they don't understand, but the less you move an arthritic joint, or the less you move a joint that is post-surgical, post-injury, once it's time for you to start moving it, and it gets stiff, the stiffness will then drive your train
Mm-hmm.
because joints want to move. Prime example, arthritics tend to do better in warmer months. That's partly, in my opinion, because we get up, we get out, we do more. In the winter, you stay in, you're not moving, you get stoved up, as they say. Joints like to move, right?
Yeah.
So that the regular activity is still super important, even if you're arthritic. But it hurts when I move. I understand. However, let's work on getting the discomfort under control so that you can move. Because I
Right.
promise, if you don't move and you get stiff, you will hurt. I give people the example all the time. So, what if, unfortunately, you're involved in an accident, you sustain a head injury, you're in the hospital, you can't get up, you can't do anything. I said, your doctors actually order the therapist to come move your joints for you
Right.
because you can't do it. God blesses you, you wake up, they say, okay, you can leave. If they haven't been moving your joints
You can't
for
leave.
6 days, you're not going anywhere.
Right.
You're not going anywhere. So that movement is important. So inflammation shows up. Pain, yes. Pain usually leads to stiffness because people stop using the joint because it hurts.
Right.
Um, And then the swelling, like I talked about, the swelling begets pain because it stresses the capsule. That's one of the reasons why when people do have large swollen joints, it is effective to see your physician, your surgeon, whomever, to drain the joint, because then
Mm-hmm.
that alleviates the pain pretty quickly so you can start moving. Will your body resorb that fluid eventually? Typically, yes. But to jumpstart it and get it going, we aspirate the fluid. Sometimes that's really important because you can send that fluid off to the lab to see if you can see why the joint is swelling often, especially with things like gout or pseudo gout. You can check the fluid for crystals, et cetera, et cetera. The fluid can tell you a whole lot. Even just looking at it
Right.
in the syringe, it can tell you a lot. So if I had to wrap that up, that's what I would say. Chronic inflammation weakens tissues, predisposes them to injury or wear and tear, which leads to the pain, the swelling, stiffness, and arthur. So arthritis is the thing.
Right.
It's the thing that everybody wants to avoid, but it's
Right.
hard to avoid.
It
Hard to
is.
avoid.
Yeah. Thank you. That was really, really helpful to go through how all of it kind of comes together. And I think that gives us a lot of clarity. Okay, so I want to ask you this also about, because you have a unique practice, and the way you practice allows people to get seen quickly and
Mhm.
easily, and helps them have personalized care. And I think that is just so valuable, especially, in this day and age, getting in to see a doctor, especially getting to see a specialist, can be pretty challenging. So I want you to share a little bit about that, but also add what is one sustainable step that a person can do right now to support their metabolic health and their joint health at the same time.
Well, my practice, I didn't expect to be in private practice at my age. But that's just how it was handed to me. Employed practices just did not work out for me. And after that happened a couple times, I was like, you know what? I can do this by myself if it's going to be this way.
Right.
So my practice does allow me to be more personable. I do go to patients. I do not have a brick and mortar. Most of my services are mobile. I accept traditional Medicare and cash paying patients. I do not accept any other commercial insurance because it actually limits what I can do to help my patients. And
Yeah.
that's another thing that I didn't understand until I was in employed healthcare for for a long time. So yes, pretty quick, get in with me. I'll come to you or I'll meet you at, your primary care doctor's office, your physical therapist's office, anything like that. And I have time because I dictate my own time now. So I spend a ton of time educating my patients. And I used to do that in employed healthcare too, but that limits the number of patients you can see in an hour. So it was kind
Right.
of like they really want you to educate because that makes your patient satisfaction score is awesome, et cetera, et cetera. But you can't see that many people if
Right.
you don't get more time in the day or the hour. So
And let's just say
I
they
take
would
it.
rather you see more people.
They
Right.
rather you see more people, but then they're upset when your when your satisfaction scores aren't great. And I'm like, you can't have it both ways, people. You
Right.
cannot. So I spend um, an hour with my patients when I see them, especially my new patients, going over um, their history, their exam, their imaging with them if they want to see it. Some people are like, no, I don't want to see it. Um, and we talk about how we can make the patient better. I don't talk, I talk with my patients. I don't talk at them, right? Because one thing, you can have a beautiful plan, but if your patient doesn't participate, it
Right.
doesn't matter. So if I can get them to buy into what we are doing, then that typically does help. And when it comes to joint pain or patients that have these underlying conditions, I just tell them. I did a little TikTok the other day when I was out of town, and me myself, I haven't been moving as much as I need to as of late. So just move. I mean, go walk. It doesn't have
Right.
to be perfect. We get caught up in that, like, oh my gosh, if I miss a day or if I'm not passed out by the time I get done working out, it must not have been worth it. Just go walk.
Mhm. Yeah.
Go. If you swim, swim. Walk in the pool. Just move. And
Right.
once you start to move, it may be uncomfortable initially. And I tell patients that, you
Mm.
know, you haven't exercised in however long, you may be uncomfortable, but that discomfort shouldn't last, um, you know, an extended period of time. You shouldn't have any associated problems other than the discomfort. And it should be more of a soreness versus a 10 out of 10 discomfort. If those types of things occur, then you should reach out to your physician. But even if you know you have the ability to just walk around in your yard, just walk. You don't have to lift weights, you don't have to do squats, you don't have to do push-ups, you don't have to do anything like that. You can build yourself up to that point, but just move. Just get up and move. My mom walks around her house
Hmm.
because her footing is not that great. So instead of being outside where she may fall, she just walks around in her house,
Hmm.
makes laps in the house. And she has a little stationary bike that she sits on and relax. Just move. And I
Yeah.
think your joints will definitely appreciate it because they like to move. They were given to us to move.
Right.
So they'll appreciate it, and your body will too, because those extra steps will likely lead to some decreases in your overall inflammation, whether it's coming from um, extra weight, high blood sugar, hypertension, anything like that.
Yeah. No, great advice. Just move. Yeah, well
Mm-hmm.
said. I think you have, made the point. So
Just
I
move.
will leave it
I
there.
like to
Move.
wear my walk with a doc shirt
Oh, love
because
it. Yes.
walking is, I mean, just that simple. Just
Right.
mm-hmm.
Awesome. Yeah. And so the walk with the doc, that we'll put more information about that because that's something
Okay.
that Dr. Johnson does. We'll have that in the caption as well. So if you'd like to join that, that would be awesome. So a big thank you to you, Dr. Johnson, for breaking this down so clearly. And if you are in the Houston area and you need expert, convenient orthopedic care, Dr. Johnson offers direct specialty mobile orthopedic services, very unique. And we're going to put all her information in the caption here. So please reach out if you're in need of this type of care. And if you're in the Houston area, you're looking for a primary care doctor who would help you build a healthy foundation so you can heal from the inside out, go to intouchprimarycare.com and make your appointment today. So thank you so much, Dr. Johnson. We got
You're
to do
welcome.
this.
Thanks for having me. Hopefully everybody gets something out of that.
Oh yeah, I did, so I'm sure they did. Thank you for stopping by and have a great day.
Okay, you do the same.
Thank you.